Welcome everyone to IPM's virtual forum, where we've been gathering here on Fridays for the past year and a half with our IPM family of friends, project partners, board, and staff as part of our ongoing response to the COVID-19 pandemic and other vital social justice issues impacting our world. I'm Ilse Fender. I'm part of the IPM staff here in the Cleveland office, and I'm stepping in today for our CEO, Joe Cistone, who recently, in fact, just last week, had eye surgery and is still recovering. While Joe had hoped to join us this morning in person, he is still dealing with some issues related to light sensitivity, and the doctor has strongly convinced him to stay off screen. So and for those of you who know Joe, that's not an easy task. But that being said, I hope you'll join me in keeping Joe and his eyes full recovery in your special thoughts and prayers as we look forward to having him back to moderate next week's program. Today, I'm happy to introduce as our forum presenter, my wonderful colleague, Adela Zayas, who is based in El Salvador and joined the IPM staff in 2016 as our regional associate for Latin America and the Caribbean. And today serves in really a dual role, working globally as IPM's Director of International Partnerships and Programs, so as our regional director for Latin America and the Caribbean. Adela, for those of you who have had the pleasure of meeting her, know she's a multi-talented, extraordinarily committed and passionate young woman dedicated to human rights and social justice issues. Adela received her degree in psychology from the University of Central America, and since that time has led or coordinated a number of very powerful and wonderful social movements, including projects related to environmental consciousness and conservation, community development, gender equality, women's empowerment, and just a whole slew of other issues. As a psychotherapist, Adela has volunteered and provided psychological therapy sessions to children, adolescents, and youth, as well as adults, helping to build and promote a more positive for focusing on mental health. We are incredibly grateful for Adela's leadership and work with our project partners, which leads us to today's topic she will be addressing, where we'll be taking a closer look at mental health during COVID-19 and really reflecting upon the effects, challenges, and opportunities COVID has brought to today's world from a personal and work experience perspective of IPM Project Partners, particularly in the Latin America region. And with that, I'd like to turn it over to Adela. Please feel free, for those of you that will have questions, to put those into our chat function if you're on Zoom, and if you're joining us via Facebook, please feel free to engage that way. But for now, I'm grateful to turn it over to Adela.
Thank you so much, dear Ilse. Can everyone hear me well? Perfect. Thank you so much for the introduction, Ilse. For me, it's a really great pleasure to present about a topic that I'm really passionate about, which is mental health. As Ilse was mentioning, we as a Latin American staff have tried to include this component and this very important part of our human health into the work that we do with our project partners. So today I'm going to present to you a little bit about the effects, about the challenges, but also the opportunities that many of our project partners here in the Latin American region have in terms of mental health. So for that, I would like to start sharing with you my screen and sharing with you a presentation that I have prepared. So let me know if you can see it. I'll start it right now. Okay. Can you all see the presentation?
Yes.
Perfect. Okay. So as I was mentioning to you, today we're going to talk about mental health care during COVID-19, and specifically about IPM Project Partners Project Partners challenges and opportunities in the Latin American region. So this is going to be a space to reflect upon the experiences that we have had as a Latin American staff with the project partners, but also I would like to share with you some statistics and some data to start with the presentation, so you can have an idea on how mental health had been impacting us as a region during these past 2 years. Okay. Okay, so first I would like to show you some numbers about the most common mental health problems. All these data is recollected by different studies or researches carried out in the Latin American population from different universities and also governmental institutions all around the Latin American region and also the Caribbean. So as we can see in the first column, we have the mental health problems encountered during COVID-19. And on the side, we can see the number of articles identifying mental health problems. So since the data couldn't be recollected as in the past, making surveys the same way that we used to do because of COVID, different researchers have encountered a new way to collect this data. And this is through different articles that other authors and other academics have made during these 2 specific years of the pandemic, so 2020 and 2021. So the most common mental health problems we can see is anxiety, followed by depression, then by fear, stress, post-traumatic stress syndrome, then irritability or anger, emotional exhaustion, insomnia, and suicide. And these are in order. So the first most common mental health problem felt by the population in the Latin America and Caribbean was anxiety. And this doesn't mean that all these mental health problems are a mental health illness. I think it's very important for me to make a difference between a mental health illness and the symptoms felt by some people through the mental health illness, which is not the same. So these different studies are related to the symptoms that people have felt. So many people maybe have felt symptoms of anxiety, depression, fear, stress, and all the listed mental health problems, but that doesn't mean that they have a diagnosed depression, for example, or that they have post-traumatic stress syndrome. They feel the symptoms of this mental illness. But this is not less important or valuable. It's just important to know the difference, but it still matters and it's still important. So now we're gonna take 2 examples of some of the percentages indicating that how populations suffer from symptoms of anxiety in 2 very specific countries. And this is going to be Brazil and Colombia as well, which is 2 countries where our project partners are working in Latin America. And so in these, and we're going to take anxiety because it's the first most common felt mental illness in the region. And so we can see in this chart the anxiety percentages indicating having felt anxious in the last week versus contagious new daily cases during the pandemic. So the yellow line represents the the contagious or the COVID cases announced by public media and news in general. And then the red line shows the percentage of anxiety rates that people have felt between April 20 and August 2021. The 2021 is missing right there, but it's August from this year. And so we can see that the lines are very close together, meaning that when we hear more about the COVID cases, when we hear more about deaths, when we hear more about the consequences, of course, the anxiety rates and our anxiety percentages also go up in this pandemic, which is not a surprise. But these studies, the most interesting thing that these studies show is that a lot of people that suffer from anxiety in the past also feel anxiety, and it's getting, and these symptoms of anxiety are getting even worse with the pandemic. But many of the population that did not suffer from anxiety and have never experienced any symptoms from this mental illness before the pandemic are now experiencing in this pandemic. So this is why a lot of the line is low at the beginning, but then it gets higher because the percentages of people that feel the symptoms of anxiety grows by the day, just as the COVID-19 contagions as well. And so we have a very similar case in Colombia. This chart also shows us the data from April 2020 to August 2021. And we see here that, that the chart is a little bit different in the beginning, in the middle, and at the end. So in the beginning, there seem to be a very small percentage of people feeling anxiety in the beginning of the pandemic, when the COVID cases were at its peak, let's say it like that. And this was, this study and this very specific research said that this was because people were not really still experiencing any consequence, even though we heard a lot of news and we heard about the consequences that COVID-19 brought for many of the population. We don't really were prepared mentally to know or anticipate or prevent what was coming with us. And it doesn't only include the symptoms of COVID-19 itself, but for example, quarantine. Many of us have never had an experience like that. So that's why the anxiety levels were not as high in the beginning, because we didn't really know what the consequences were going to be. And then when the time goes by, from August to December 2020 to May 2021, we can see the two lines very close together. And sometimes even though the contagious cases are low, we can see very high rates of anxiety. And as I was telling you in the last chart as well, we can see how the percentages of population is growing. We can see how more people experience anxiety since the COVID-19 pandemic started, and how it's going right now. Okay, so now I'm going to present to you another chart. And I think this one is very important because it shows, and I couldn't find it in English, but I'm going to translate it. I think this chart is very important. It is very important because now different researches and studies show us that a lot of the population, not only in the Latin American region, but also around the world, are feeling now some kind of symptom of mental health illness. they do not have a mental health illness, but they're experiencing the symptoms. People that have never experienced a symptom in the past, not only in the region, are now experiencing it. And despite this, a lot of the percentages of people, a lot of the population is not receiving the attention and the health care that is needed. And this research shows the percentages of people that receive the help, but from governments, from governmental institutions, governmental authorities, and the state as well. It doesn't show the percentages of people that receive some kind of mental health, because in the family, at the personal level, at the communitarian level, we can also see that there are people trying to do an effort to provide these types of services. But this chart only shows what the governments and the states have done in terms of mental health for the population. And so the chart says that the percentages of, that the percentages, the percentages of Latin American countries in each region that offer certain grade of coverage in terms of mental health. So the gray square says that people doesn't receive any type of support. Then the red one represents the people that experience some kind of mental health problems, and then the both yellow squares represent that the population that have most mental problems, but there are the problems are not the problems are intense. Then the red one represents the people that experience any kind of mental health problems. And so this is the chart per region. And we can see in the United States and in Canada, the people that experience the most intense mental health problems or experience mental health symptoms or illnesses, 100% receive some kind of mental health, some kind of mental health services. Then for Mexico, Central America, and the Caribbean, 11% of people do not receive any type of support. 44% of people that have some kind of mental health problem receive 44%. 44% of this population receive mental health support. Then the people with the most intense problems receive 22 and 11%, and the most people and only 11% of the most people that experience any type of problem receive 11%. The people that receive mental health services and that are the majority of the majority that have any type of problem receive only 1100%. And then in South America, this it's not and then in South America, 44% of people with problem receive mental health services. Then the 22 and 33 people, 33 population represented by the people with most intense mental problems receive these types of support. So we can see that the majority of people that experience intense mental health illness or mental health problems do not receive the support that they need. And these the percentages of people also that receive mental health care also has to do a lot with the income that they have at their houses. So this study also tell us how the level of income that people have also represent the percentages of mental health care that they receive. And if the lowest the income, the lowest support that they receive, which is very ironic, because the people that have the most highest income that are able to have access to this type of mental health care they have all the resources to have access to these services, but they don't necessarily look for it. And the government and the state do not provide the opportunities and the services that the population with low income levels need in different parts of Latin America. And now I'm going to show you the next slide. And so after that being said, and these data and these numbers represent like they don't only represent numbers, you know, they're not only data. They are people experiencing problems all over Latin America during this COVID-19 pandemic. And we know that a lot of the mental health problems that we experience have to do with the context that we live in. So now I would like to talk about the challenges that many of our project partners have been experiencing in these past 2 years. So as you all know, we have project partners in Colombia, in Centro de Formación para la Paz. We have project partners in Nicaragua, CEPROSI, and Mujer y Comunidad. We also have project partners here, Patronato Lidia Coyola, Musas Creativas, and Acomujersa. We also have 2 more project partners, Nutravida and IDES, but their logos are not represented here, but we are going to talk a little bit about the challenges that they have been experiencing in the past 2 years. And so for Centro de Formación para la Paz in Colombia, this well, before I start to sharing with you what I want to share, as you may recall from last forums and from last meetings, we have regular monthly meetings in presence or virtually with each of our project partners, where they share the challenges that they're experiencing, where they share their current reality, and in general, where they share most of their personal and professional experiences in this pandemic. And they have authorized us to share many of the information that I'm going to share with you. And so they know that that it's very important to spread the word, even though sometimes it's not good news and successful stories. But challenges are also important to hear, even though sometimes they're hard. So as I was telling you, so for Centro de Formación para la Paz, this has been a very hard period in terms of funding, because a lot of the donors of the organization have backed down their support because of economic reasons. And this is the same case for Mujer y Comunidad and in Nicaragua. So these 2 organizations have been struggling a lot with the funds that they need to run their programs. And this specifically affects the 2 leaders and the staff in general of the organization. And this has brought a lot of chaos inside the organization. And the 2 leaders of these 2 projects were sharing with us during these calls and these meetings that these situations have been very very intense for them, and that they sometimes feel weak, sometimes they get sick, sometimes they get also mental health symptoms such as anxiety, for example, and stress, and very high levels of stress. And this causes a chain of consequences, not only inside the organization work, but also in their personal lives. So it has been a year of, for them, as they were saying, of a lot of pressure. And even though these challenges are very felt by them, they still want to find a way to get more funds to support the population that they work with, because despite of all the COVID-19 contagion, with all the COVID-19 cases arising in both of the countries, people still supports the organization and are still and also are still waiting for the support that these two organizations provides to them. But it hasn't been easy for either of them. Then we have the case of Acomujersa and also Musas Creativas here in El Salvador, one located in Zaragoza and the other one located in Armenia. These two organizations have suffered from personal losses. Some members of the organization have suffered from losses because of COVID-19 and because of other reasons as well. And these personal losses sometimes interfere with the work that the organization does. And it's hard for the teamwork because it impacts when this organization all functions as machines, and every piece is very important. And if one piece is missing or is sick or is not feeling well or is just not there, the machine doesn't work the same way. So this has been the case for these two organizations. A lot of these pieces, these very important pieces, are not working as they used to, are not working in the regular basis because they are suffering, because they're grieving. The impact of a personal loss has been so important for them that they need to take time for themselves. And I think it's very admirable, very impressive from these two organizations, that even though that they know that their work is not the same with these two, without these important pieces or these people that are key for the organization to work with, to work well, they still encourage the people that are suffering from any type of loss to take their time. And they are also supporting the people suffering from loss. But it has been very hard for both of organizations. Then we have the case of Seprosi. The case of Seprosi is a little bit different in terms of funding, because I know we're talking about challenges, but something that has been going very well for Seprosi is the funding. The donors that they count with have not backed down, and they are still supporting the organization. But this doesn't mean that they don't have any other type of challenges. So for Seprosi, since we had different conversations with Xenia and other members of the organization, despite they have secured their funding, the economy in general of Nicaragua it's in a very bad situation, and and this is because of the political instability. And so, of course, this impacts the project partners over there. This impacts the women working at local stores with their small businesses. So even though they have the support of other organizations, sometimes they do not have the support of their own country, or sometimes their locality, their neighbors and the people inside the different communities that they work with. Because of the political instability, there are a lot of different opinions, and sometimes people in the same neighborhood, in the same community, have very different views about the government, and so this create separation and polarization between the population. And this, of course, it doesn't also impact the personal life of the women and the people working in this community, but also the economy. And of course, as we said in the past, the context that the people live in also impacts their mental health. So when things are not going well in terms of economy, in terms of human relationships, in terms of teamwork, in terms of organizational support, in terms of grief, of course, it's going to affect in a negative way their mental health. And so they have been struggling with different kind of human relationships in Seprosi and in the area of Nindiri specifically. And then we have the case of Patronato Lidia Coyola, which has always characterized by the resilience during any type of situation, nationally and globally, and this is not the exception. Patronato Lidia Coyola have shown a lot of efforts to support their local leaders, the people that they work with, but they're still suffering from different challenges. And one of the challenges specifically right now, and this is very new information. I just recently talked to Carlos during this week, and he mentioned that the COVID cases are getting high in the community, are higher and higher. And just 2 days ago, they lost a very important leader. He was very young, and this has made a great impact in the community, because now, even though the community in Patronato Lidia Coyola, in El Saite, in Zaragoza, have always been very supportive of each other, now they are afraid to look at one another, to be with one another, because of the COVID cases, and specifically because of this loss, this great loss of the communitarian leader. So even though they still want to support the community, and they're still making different efforts inside the community to support one another, the fear that people are experiencing is not allowing them to work in the same way that they used to. And so this is a great challenge, because when people are afraid to look at one another, when people are afraid to meet and just to talk with one another, the organizational work, it's not the same. With all the information and all the experience and all the challenges that our project partners have been experiencing and having trouble with, despite all this, they still find different ways to stay connected, not only inside their communities, not only inside their projects, but also with one another. So during this year, I think one of the most things that we need to point out is that at least the people here, at least the project partners here in El Salvador have been visiting one another and to create a wider support in the communities. And I think this has had a great impact in the in the human relationships, and of course also in the mental health of the project partner and of the participants of the project partners. And so now I would like to show you another slide. And so all these challenges and that our project partners have been struggling with, and all people in Latin America in general have been struggling with, require an intervention in terms of mental health. So this pyramid shows us the ideal of the intervention, or on how an intervention should work. And so in the first piece of the pyramid, we can see that we have social consideration in basic services and security. And these provide all these interventions, or the ideal of interventions are to secure not only a good mental health, but also a good health in general for the population. So the social considerations in basic services and security, we have some examples of this, and this could be the advocacy for basic services that are safe, socially appropriate, and protect dignity. The second piece of the pyramid is the strengthening community and family supports. And an example of this is activating social networks, communal traditional supports, supportive child-friendly spaces. These are examples. The other one, and we're getting to the top of the pyramid, the other one, level of intervention is focused, a more particular type of intervention, which is person-to-person, non-specialized supports. And an example for this would be basic mental health care by doctors, basic emotional and practical support by community workers, for example. And then in the top of the pyramid is the specialized services. The mental health care, an example for this is the mental health care by mental health specialists, meaning psychiatrists, nurses, psychologists, etc. And so I'm showing you this pyramid intervention because these the top of the pyramid show us that the specialized services are very important, and these types of services sadly could not be guaranteed by the communitarian support. They cannot be guaranteed by the community, by the project partners, by the nonprofit organizations. These services have to be provided and guaranteed by local governments, by the state, by national governments as well. But the efforts to do so in each of the countries of Latin America have been very low or even non-existent. But the other parts of the pyramid, the other levels of interventions have been possible because of project partners, because of community, because of people that even though they don't have the resources to provide the mental health services and mental health care that a nation can provide, they are still making different efforts. And so I think this is very important to point out that all the efforts or many of the efforts that the project partners and their communities have been making to take care of other people in terms of mental health have not come from the government and have not come from local authorities, but from themselves and from the nonprofits and friends that supports them. And so after talking about the challenges, I would like to talk very fast because I just realized the time about the opportunities that this pandemic has brought to us. Well, I think one of the things that this pandemic has brought to us in terms of mental health is the opportunity to empower ourselves. And so since we talked about how the context matters a lot for having a good mental health or a balanced mental health, as IPM, we have been working with our project partners to secure, in a way, a good context, a good opportunities. And so this has empowered our project partners in a local organizations as well. So we can see women from El Saite, we can see Conchita, and we can see friends from IDES in Zacatecoluca working in different projects. And this keeps them not only mentally stable, but they keeps them together. And sometimes as we were talking in the past, as I mentioned, the human relationships matter a lot to the mental health, because it has to do with our network support that we receive. And if we have more networks, if we have more links to other people, to other projects, to other things we can materially do, we can also count them as resources, as personal resources we have. And so we can also see here, again, people from IDES, people from Acomujeres, and now women from Zaragoza, making relationships and making efforts to be together, but also to be well together, and trying to work in themselves to take care of others, which is very important when we talk about mental health. And so we also have opportunities to share what we know. We have opportunities to share knowledge. And so I think during this crisis, we don't only had the chance to raise awareness about mental health, but we also have the chance to work on very specific parts or very specific topics or issues or matters of our personal mental health. And so during the pandemic, as I think we have shared already with you, Vicky and Eneida, our Latin American staff, made different videos and different clips to help our project partners struggle, for example, with stress, to face, for example, anxiety, and also to face loss and grief. And so these videos and clips were very appreciated from our project partners. And they, from that point, we start to understand and realize how deep and how important these types of interventions were. And since then, we have been trying to work with different project partners and community partners in these types of mental health support or mental health resources, we can say as well. This is a video, but I'm not gonna show it to you right now. We can find it in Facebook, in YouTube. If you wanna take a look at it, I'll share the link with you later, but because of time, we're gonna continue with the presentation. Another opportunity that I think we have had as a Latin American staff and community partners and project partners is the opportunity to connect. So these photos are from a workshop that we provided to a community partner that is called Acobamor. They are a CBC network in La Libertad, and we in this workshop discuss different mental health topics such as resiliency and also conflict resolution. So all these mental health issues had brought us together and had brought the opportunity to connect with other institutions and organizations and work together with them. We have also had the opportunity to talk about what is happening, about what is worrying us, about what we're struggling with. And I think sometimes we would like to Even sometimes we would like to provide solutions for different projects or for different communities or for different people. I think the best thing that we can do is to listen, because people want to talk about what is happening, and sometimes they don't need for us or for other people to create solutions, but they only need to talk and to listen to themselves. And so these photos that I'm showing you right now are from a very recent workshop that we had with my colleague Fatima Pacas. We went to Arcatao in Chalatenango, and we worked with over 40 people in mental health issues as well. We talked about leadership, and we also talked about emotional intelligence, which are topics very important, not only to be a good resource for the community organization and for the community in general, but also to have personal growth, and this is very important. We also, I think we also have the opportunity to care and to take care. And so these pictures that I'm showing you right now are also from another workshop that we provided with my colleague Vicky Jimenez and also Fatima Pacas. And this relates, in this workshop, we talked about emotional intelligence. And these also have given us the opportunity to connect with other community organizations. And this group of people are volunteers from a nonprofit organization, and they provide non-formal education to different children and youth in different parts of Chalchuapa, Santa Ana. So we talked about the importance of personal growth to be able to take care not only of ourselves, but also to take care of others. And now to end with my presentation, I would like to share with you a very important resource that I think that we can all practice, and that is a way of taking care of another human being in stress in distress or in some type of problem. And these are the psychological first aid. As many of you know, these psychological first aid or PFA are not only or cannot be applied only by psychologists. And I think this gives us, all of us, a great opportunity to take care of other people, sometimes in crisis, sometimes struggling with stress, sometimes struggling with anxiety or other types of mental symptoms. And so I think this is a good resource for all of us to learn, not only in moments of crisis, although they are specifically made for crisis situation, but also in other types of situation. And so the three most important elements of psychological first aid is to look, to listen, and to link. But first, we need to prepare. So this means that we learn to we need to learn about the crisis event, about the event that has been affecting different people or different population. We also need to learn about available services and support that these people or population can reach. And then we also need to prepare and need to learn about the safety and security concerns, not only for ourselves, but for people. And so then when we are applying psychological first aid, we need to look, we need to observe for safety, we need to know, and we need to let other people know that we are safe and that we are in a situation or in a place where nothing can harm us, at least materially. Then we can observe for people with obvious urgent basic needs. We can also observe for people with serious distress reaction or stress reactions, for example. And then after observing, after looking, we can make contact with people. When we make contact, it's important to listen. And we and we are in the second element of psychological first aid. which is to listen. Then we make contact with people who may need this support. We ask about people's needs and concern, and listen to people and help them feel calm. It's not our responsibility to find the solutions, as I was mentioning, for people in these types of situation, but to listen and to listen what they have to say. And then a way that we can support is to link. And this means to reach out for, or to help people reach out for different institution resources that can provide what they need. So in this element, in the link element, we help people address basic needs and access services. We help people cope with problems, we give information, and we connect people with loved ones and social support, for example. And so all these elements for psychological first aid, I think it's very important for all of us to know, and especially in this month, which is for to raise awareness about mental health. I think one way to raise awareness about mental health is to learn some type of resources ourselves to help other people or other population ourselves. And it's not necessary for us to be psychiatrists or to be psychologists to do or to practice the psychological first aids. And before practicing this resource, I think it's very important to practice self-care. So I think it's very important to ask these questions ourselves. So before applying this type of resource, we can ask ourselves, am I ready to help? Am I connected with a group or organization for safety and coordination, or something that can provide me the resources I need to provide this support, for example? Then during the psychological first aid, we can ask ourselves how can I stay physically and emotionally healthy? What can I do? How can I know my limits? How can me and our colleagues support one another, for example? And then after, it's very important to ask ourselves, how can we take time to rest, recover, and reflect? And so for the time, I'm going to state here, and I think with all the COVID-19 situation and other types of situations arising by COVID, I think it's very important to remember that mental health starts with us. And if we take care of ourselves, of our minds, we can also take care of the world. We can also start caring about other people, about other communities, and about sometimes our family as well. But the first step is to take care of ourselves and to experience personal growth and to experience also mental balance and emotional balance. So we have been, as a Latin American and the Caribbean staff, we have been working in different resources with our project partners, trying to promote mental health resources and trying to promote mental health services in some way. And we know that this is a very important job, and we are very committed to mental health, speaking personally, and we are willing to keep this work that we have started and to continue in the best way possible, so that our project partners, community partners, and other population can have access to mental health services. So thank you so much for your attention. I'm gonna stay here, and if you have questions, comments, or any type of feedback, please let me know.
Thank you, Adela, so much for that wonderful presentation. You certainly provided a wealth of knowledge about the effects, challenges, and opportunities COVID has brought to our lives. And I couldn't help but, as you were talking, reflect on my own feelings, looking back at this past year and a half, if you will, and certainly recognizing many of the symptoms that you highlighted as far as mental health issues. And, you know, just as a staff member, being aware regionally of the work that's being done by our partners and really our regional office colleagues to support our projects. It's just been remarkable what you have done to really step into the role of providing that kind of, or encouraging that kind of self-care for our partners. And then also, I think here in the US, Joe and I always talk about, you know, our worry and concern for you as colleagues as well, because you give so much of your own lives to the work of our partners, to the work of IPM. And we're so grateful and humbled truly by what you and Fatima, Vicky, and Aneta have done in Latin America, by Mahesh and his team with Hemit, Sony, Bindia, Parveen, and so many others, and as well as in sub-Saharan Africa. So much wonderful work is being done, and so much important work is being done, particularly around the mental health issues, because that emotional anxiety, I think, that we've all felt is in various degrees, and it is so vital to having just you know, the ability to carry on and continue on with hope and love and solidarity. So thank you again, Adela, for your wonderful presentation, for the work that you and all of our colleagues are doing. I know we have a little bit of time left. We are running a little late, but does anyone have any questions for Adela? Mahesh is sharing in the chat, self-care is so important. And Adela, as you rightly said, we often work at the cost of our own healing. Yeah, oh, and there's more. Hold on just a second. Our online meetings during lockdown really helped us all. Fatima is also adding, Adela, thank you very much for such informative presentation. I trust IPM accompaniment in various communities brings not only just solidarity, but mental health support. And I totally agree with both of those. I know on Facebook, we've had members of Saprosi and Patronata Lydia Cajola joining us, expressing their gratitude and saying that they're sending their greetings from the Zaite community and that they continue to be in touch and work for peace and justice despite COVID. They are still in the fight. Again, it's such an important topic. I know sometimes the wealth of information presented is hard to kind of process immediately during these presentations, but seeing the information you put up there and knowing that it's being done by our partners is really just continuing to inspire and give us all hope. So thank you all. Aneta is also commenting, beautiful presentation. Thank you so much. Margie is also saying beautifully and sensitively presented. Jim Campafner is thanking you as well for a thorough and informative presentation. Bindia also is expressing her gratitude. Yes, we're all so very grateful for the work that's being done. Anyone else want to share anything? Okay. Well,
Ilza, I want to thank you for, you know, without Joe able to, we're so lucky to have you to step in and so solidly moderate and run things and hold things together and hold down the fort. So thank you very much.
Well, thank you, Jim. Well, if for some reason Joe isn't able to join us next week, maybe we'll have you moderate this.
I wouldn't be able to do as well as you.
Yes, you would, but thank you for that. That's very much appreciated. I did want to mention that next week's program will feature our own wonderful Mahesh Upayata, who is our director in our South Asia office. I'm not sure if Mahesh will be presenting by himself or along with his wonderful team, but we look forward to that. And I don't know, Mahesh, if you wanted to mention anything real quickly. I know we're celebrating 2 holidays, both in India and Nepal, Navaratri and Dasharan. I don't know if you, Mahesh, or Sony would like to say anything just real quickly about the significance.
Yeah, I could, but I think the music is too loud over here. So I'm not sure I can hear my own voice in the cacophony that is on. But certainly, yes, we have 9 nights of dancing and divine worship of the feminine divine going on. And Dasara will be the 10th day, and it signifies the victory of truth over evil. So the truth of good over bad. So it's a good day to share about the work that we are doing and all the issues that we are confronting there. So I look forward to it, along with Bendya, Himmat, Soni, and Parveen, and Shahada. It will be a joint effort. And we would like you to hear as many voices as possible on that. Thank you.
Thank you, Mahesh. We enjoyed the background music and look forward to hearing more next week. So with that, I think we will conclude today's forum, and thank you again. And may the peace that passes through all understanding continue to be with all of you. Thank you, everyone. Take care. Bye-bye.
Thank you.